Welcome back to Bloom. We're exploring 2025 health trends, and more medical experts are using DNA kits and other studies to analyze a patient's health. This helps with identifying potential genetic risk factors for certain diseases, confirming a suspected genetic condition, or determining if a patient is a carrier of a genetic mutation that could be passed to their children, especially if there's a strong family history of a particular disease. But it also helps doctors and nurses make more informed treatment decisions based on a patient's individual genetic makeup. Joining me now from Tampa Bay Total Wellness is age management specialist Tammy Oberbreckling. Tammy, it's so great to see you.
You too, Gail.
So I know you sent me home with a kit one time to do a urine sample, and that was able to give you so much information to tailor a health program for me personally.
Yes, sometimes blood work is not enough alone. So you were having some side effects from medications you were on. So we did the urinalysis, which looked at how are these drugs you were taking being metabolized in the body and what was the breakdown, and looking at those metabolites, which sometimes can be dangerous in the body.
So for me specifically, we were trying to balance my hormones.
Correct.
And you were able to tweak the delivery method and get me on something that my body responded to really well.
Exactly. So it gives us a very specific picture of who you are, and it's really good for people who have family histories of cancer or other genetic things that they're concerned about.
So how else do you use these types of kits in your practice?
So we can take now a deep dive either through blood, saliva, or urine into the genetics behind disease. So we are born with a certain DNA or makeup of who we are. And if we know those conditions, we can alter our lifestyle to prevent from developing sickness and disease down the road.
So it's not only is it information that you can have for immediate medical attention or medications that may or may not work and know which ones to prescribe, but you can also change a patient's lifestyle choices?
Perfect answer. Like mine, I had mine done recently, and it showed I had the genetic marker for early cardiovascular disease and stroke. So I can make lifestyle changes now so I don't develop those as disease conditions down the road.
And we kind of did the same thing when I received my full body scan from Lifeguard Imaging, sent the results to you. You saw early on stage osteopenia, which my mother had and my grandmother had, and you could address that as well. I mean, you don't have to have brittle bones anymore if you're a woman.
So when we saw that, we hit it head on. You know, we corrected your hormones, got you into the weight-bearing exercise and things like that, and are excited to see your next test to see if this is corrected.
Yeah, hopefully I'm going to get in there in the coming weeks with my husband again and get another full body scan, because it really is interesting as to how proactive we can be with our health, and especially in your field of anti-aging.
It is, and a lot of times people will come and they're frustrated, like, well, my doctor did blood work and they don't have an answer. Well, sometimes we need more than just one number on the blood work. We need to see how the body's reacting to us, what's your genetic makeup, and take a deeper dive into all of that to really come up with a solution so that you don't have to do sickness and disease as you age.
And I think too, taking this deep dive, the way you look at medicine and the way you help your patients, it's like, as you know, I had been going from one specialist to the next for years, even with thyroid issues. And just by compounding medication and looking at the blood work differently, you were able to zero in on exactly why I wasn't feeling better, and I was dealing with all these hair loss issues and weight gain issues.
And in that case, you were given a thyroid preparation, but it wasn't tailored for you. So when we dove deeper into those levels, like, oh no, we need to have it made specifically for you. And that was the key. And once that happened, everything started working like it was supposed to.
Why do you think it is that so many patients are suffering and they're getting their blood work done and they're going to their annual checkups, but they're still not seeing the results?
One thing that I see is a lot of times the providers are reading the lab value as normal, and it's not normal, it's not optimal. So there are levels that are lab normals, and then there's levels that the body needs to function optimally, and we're just not educated to look beyond what we see on the paper.
So you always need to take it a step further and do a deeper dive with those blood results, because just tweaking medication slightly can be a game changer.
Completely, or looking at what's in the medication. There are so many synthetically made medications on the market that aren't good for us. And there are safer alternatives, and looking, what is that safer alternative? What lifestyle changes can I make? What can I do to be proactive in my health instead of reactive once I'm sick?
So you talked about the urine test. Are there other tests that you offer through your practice?
So there's several really deep dive tests. The urine test is physician labs, and it's for anyone that has concern about their metabolic health or hormonal health or has a family history of cancer. We have Boston Heart Labs, where people can take a very, very deep look at their metabolic and cardiovascular health. It's more than just a cholesterol. It looks at everything to see if you're going to be set up for heart disease or stroke or diabetes. And there's even gut studies where we can look deeply at your gut biome from your mouth all the way through to make sure you're eating the proper foods and absorbing your nutrition.
Thank you so much, Tammy.
Anytime.
All right, we're going to share Tammy's advice on bloomtampabay.com. And when we come back, the movement to take dangerous chemicals like red dye number 3 out of our foods, and advice from experts on what candies you should be reaching for.